Hello, hi, this is Dr. Itham. Hope you all are doing very well. Today's topic is cervical spondylosis. So, as the name implies, so it is something that is related to the cervical vertebrae. So, it's actually a degeneration of the cervical vertebrae and the discs between them, putting a pressure on the spinal cord, thus producing certain symptoms, which we're going to discuss in a minute. Let's talk about anatomy a little bit. You know that these are the vertebrae. So it's the body, this is the spinous process, and behind the body, it's cervical canal where runs the spinal cord. So what happens is that this is one vertebrae. Over that, there will be vertebral disc, and above that will be the another vertebra, and thus it continues downwards actually. So let's go a little further. So that's gonna be one vertebra above that, second, third, and that continues. And above there is a intervertebral disc. So here it is actually the spinal canal where runs the spinal cord. Now what happens is that from these foramina here you can see, so there originates from the spinal cord. It runs the spinal nerves. That's how it exactly looks like. So actually it is like, this is the spinal cord, so this is dorsal nerve root, ventral nerve root. They combine to form spinal nerve, and then it divides into dorsal rami and the ventral rami. That this is how it is actually. So mostly it is these nerve roots, these are compressed either because of the degeneration of the disc itself. So you can see that it says vertebral disc. So when it degenerates, so it can push backward and put a pressure on this spinal nerve root. Or the second thing is because of the degenerative process in the vertebrae. What happens is that when there's a degeneration, they repair itself, and when they try to repair, they overgrow, producing the abnormal growths. Here you can see the abnormal growths, what we call is bony spur sometime. That leads to the narrowing of this canal actually, and sometimes this thing presses against this nerve root, thus leading to certain symptoms. So it's either a degenerated disc, or it is the vertebrae itself. Because of the degeneration, as I said, they overgrow, producing the abnormal growths like the spur that can press the nerve and produce the symptoms. Okay, let's go backward. Most common cause of cervical spondylosis is osteoarthritis. That's the most common cause. Um, so it's mostly present in the middle age or the older people. Okay, let's talk about the symptoms. So the symptoms they are produced either because of the compression of the spinal cord or the spinal nerve roots, or both of them. So sometimes the first symptom is just the pain and the stiffness in the neck. Okay, that depends on actually the degree of compression. So that's just a neck is the patient's neck is painful, it's less flexible, and it's stiff. As it advances, what happens is that there is abnormal sensations in the hand initially. Okay, and can be present in the feet as well. And if that's too severe and it's not managed, that could lead to the paralysis as well. Very severe compression can lead to the bowel and bladder dysfunction. Okay, so the first thing is pain and stiffness in the neck, hence less flexible. Then it could be like abnormal sensations, and in the hands, in the arms, and if severe enough, that can lead to bowel and bladder dysfunction. Also, it can leads to the reflexes in the legs. They become exaggerated, and the legs become jerky, and walking um becomes unsteady. So that depends on actually all the severity, starting from pan stiffness, neck simple that, then have abnormal sensations and stiffness and weakness of the arm, and yeah, then your legs, they become the walking is impaired. This becomes unsteady. There's spasticity of the legs. The reflexes become exaggerated, and in more severe cases, yeah, bowel and bladder dysfunction occurs. If we talk about the diagnosis, okay, the first thing that is the clinical um, examination and history. Okay. The second thing is you go for the imaging, that is the MRI. That is actually a choice here. Um, can go for the CT or myelography, but the CT actually, the advantage of the MRI is that MRI shows the spinal cord as well as the nerve roots, which the CT doesn't. Um, so the MRI is the choice here. Um, the next thing is if we talk about the treatment here. So the first treatment is okay, is the pan there. So it's NSAIDs, non-steroidal anti-inflammatory. Uh, mm, they work as anti-inflammatory as well as analgesics, because compressing the nerve root, that does produce some inflammation along with the pan. Then a soft neck collar that can help. Um, the other thing is sometimes um, you might need the muscle relaxant, okay, because your neck becomes stiff. So you need, and the muscles go into spasm. So muscle relaxants, and in few cases where it's severe enough, um, the patient might need a surgery, particularly a procedure that is called laminectomy. Okay. Yeah, the other thing, if we talk about the surgery, if a bony spur, spoke about that earlier. So if that's over there, that can be removed as well. Remove, yeah, bony spur, abdominal growth, that might help. The surgery is done in severe cases, and it prevents the additional nerve damage. Um, but it usually doesn't reverse the existing nerve damage. So once the nerve damage is done, it's done. But the surgery it prevents the further um, nerve damage. That's helpful in this regard. So NSAIDs, neck collar, muscle relaxants like baclofen, and surgery like laminectomy, or if a bony spur is there, to remove that one.